the U.S. House of Representatives has introduced a bill to strengthen the Affordable Care Act. It's being called the Protecting Pre-Existing Conditions and Making Healthcare More Affordable Act of 2019. And what it wants to do is right in the title. It's House legislation introduced March 26th by 3 different Democratic representatives. It's called A Plan to Strengthen the Affordable Care Act. It was unveiled immediately after the U.S. Department of Justice announced it was going to refuse to defend the Affordable Care Act in the lawsuit of Texas versus United States. It was an instant response, and it goes into 3 main areas of strengthening the Affordable Care Act. The first, expanding affordability of health insurance. Second, undoing the past history of administrative decisions that have been quite negative. And number 3, promoting state innovation and transparency. Let's go through those quite quickly, but we'll start with affordability. In the bill language, it expands tax credits. It makes financial assistance more applicable to more people, including more lower income and more middle income individuals. It goes so far as to extend tax credits, advanced premium tax credits in the health reform marketplace to people above 400% of the federal poverty level for the first time, to catch folks that might have been a little experiencing sticker shock on the last open enrollment period by some of those plans that had very high premiums. It also does something that should have been done years ago. It fixes the family glitch. That is the name of that conundrum in the bill where they looked at the affordability of employer-sponsored insurance by looking at employee-only plans and not family plans. So it changes some of the language in the Affordable Care Act to make sure that the affordability test is a little bit more reasonably done. In that second category of changes, it reverses the administrative decisions, and some political pundits are calling this the undue sabotage provision of the House bill. It reverses the short-term and association health plan rules that were implemented as final rules by this administration. Now, we're going to talk about the association health plan final rule in a separate video because there is some new development in legal action over that one. It revokes guidance on 1332 waivers. This was new guidance coming out of the Trump administration that was going to be a little bit more generous with how states could use innovation waivers to undo parts of the Affordable Care Act in their state. This bill says you can't do that anymore. It has a lot of language on protecting people with pre-existing conditions. It bolsters that part of the Affordable Care Act even further than what we've seen to date. And it codifies changes to coverage of essential health benefits. It makes it very clear what are guaranteed health coverage areas and who can be covered by them. It also includes a lot of funding provisions for navigators, for outreach and education, and for state reinsurance programs. And it goes so far in state reinsurance programs to not only make money available for states to run a reinsurance program, but if the state chooses not to take the money to do it, the feds will do it for you. So it prioritizes reinsurance, whether it's state-run or federally administered. In the third category in this House bill of priority is that innovation and transparency language. It brings back the consumer assistance programs. Now, a lot of our viewers might remember that from several years ago, a priority to help not just navigate people through open enrollment, but to help people with insurance and Medicaid and the other silos of health coverage and optimize the health care and coverage that they have coming to them and maintain that coverage. Those consumer assistance programs were quite popular. They worked quite well. A lot of Republican governors sent the money back, including our own governor here in Wisconsin, saying we don't want to help people with consumer assistance programs. And then states like Texas, which were doing consumer assistance quite well, continued to apply for that money, but found that that pot of money dried up from the legislature. So this bill would bring that back, bring back consumer assistance programs to help not only with enrollment in different types of insurance platforms, but also to help people file complaints, to navigate appeals, to learn more about their health rights, and to track consumer complaints and better identify where more accountability and enforcement was needed. Similarly, there are additional provisions for ways we can make enrollment more innovative, whether that's building a state exchange for marketplace plans, whether that's investing in technology for better data and outcomes tracking, or whether it's just getting more reports to Congress in a timely fashion to be accountable with how open enrollment and call centers and all of the other provisions that go along with administering health insurance is doing, something that is lacking right now. Now, what it doesn't do, this is a House bill that tried to cover the spread on very important priorities that a lot of state representatives can agree on, but it does not touch restoring the cost-sharing reduction payments, and it does not address Medicare for All, another popular point coming out of a lot of Democratic Assembly people. And the logic as identified when asked from the bill drafters was that they can tackle that later in separate bills. This was an immediate reaction to saying the Affordable Care Act serves no purpose, as the Department of Justice said, from the Assembly saying, no, yes, it does. And in fact, we can actually make it a little bit stronger. Now, the House expects to try and pass individual provisions of this bill one by one, not take it up as one big chunk. They do anticipate political fights to come, as we can anticipate, and they definitely know that this is going to be a way for them to bolster up some of their talking points about the importance of pre-existing condition protections and connecting people to health coverage in advance of those 2020 elections. So there is a strong political angle to this. You can read the bill and the section-by-section summary, and then the House also made available a one-page summary to help you work through some of these three main provisions of affordability, innovation, and accountability and transparency. You can send your questions about this health bill or other conversations about access to health care and coverage, and you can find us at healthwatchwisconsin.org.